Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Welcome back to Aging in Place Strategies and Answers. Friends, this is my annual podcast updating you on what is new for Medicare recipients in 2026. Those of us that are 65 years of age and older and who paid into the Medicare tax program through our FICA taxes while working are eligible for Medicare benefits. There is usually always a certain amount of time in which a person would need to pay in, and in many states that is 10 years. The Medicare tax is a mandatory federal payroll tax that is withheld from your paycheck as part of the Federal Insurance Contributions Act. It funds the Hospital Insurance Trust Fund, which covers most of the costs for Medicare Part A. If you are eligible for Medicare, it's time to go to medicare.gov for more information on how to apply and receive these benefits. I would also want to share that even if you are still working and have private insurance, when you reach age 65, it may be important for you to get on Medicare Part A at least, but you may also want to do the math on the cost of the deductible that you will pay under your private insurance if you're still working, as opposed to the deductible you would pay under Medicare Part B benefit, or if you choose a Medicare Advantage plan. But now is the time to start looking at that and making sure that you're avoiding any penalties that could be applicable if you enroll later. You know, I had never thought about this, but there are people who own their own businesses that are self-employed that do not report their income nor pay FICA taxes. They may not know about those, or they may not consider it important. There are also taxes that are paid into Social Security. So I just want people to have the education, the knowledge that they need, that if this has been the way they have operated, it may be hard to learn that when you're 65 and older, that you may not be eligible for Medicare health insurance, nor receiving Social Security benefits. These are items that you needed to pay into. I learned some of this information even working in multicultural buildings, that U.S. citizens are entitled to these benefits and needed to be paying into these benefits. So please be aware of the laws and the regulations and get education about what could be headed in your direction if you are not yet 65 and how you can correct. But not to worry. It is all those of you who are self-employed and have your own businesses, you can purchase health insurance on your own at any age. And if you go to healthcare.gov, which I will have in the show notes, as well as medicare.gov, so that you can evaluate these plans through the health insurance marketplace. Be aware if you need help to pay for health insurance, there could be subsidies available based on your income. So that is a high-level point of view about who's eligible for Medicare benefits at age 65 and those who may need to purchase insurance through healthcare.gov. But those of you who are already age 65 and on Medicare, I cannot stress the following items enough. It is so important to, number one, know what kind of insurance you have. Do you have a Medicare Advantage plan, or are you enrolled in a traditional Medicare plan? And you may be scratching your head right now and saying, yep, don't know that answer to that question. Well, all you have to do is pull out your insurance card. It's not rocket science. It's not difficult, but your insurance card tells your providers, and it can tell you as well what exactly you do have. So get your insurance card out and look at it and learn where this important information is and where the 800 numbers are on the back of the card or websites. Maybe you even want to create an online portal, use their app, so that you can get the information on the internet because it is so much faster and it's reliable. You just need to make sure where you're accessing that information, that it's not a lookalike, so that you're not entering your information into an unknown website. So know what kind of insurance you have. If you are an adult child helping aging parents, please make it your responsibility to know what kind of health insurance they have. I guarantee you there will be fewer surprises for you. You will be better equipped to talk to their providers. You will be better equipped to make decisions that are being given to you. And once we learn that insurance drives healthcare, that's the reality, folks. And you'll be more willing to understand it and have less anxiety over it. But it will also make sure that you are paying attention to open enrollment dates, which began October 15th and will go through December 7th. Remember that when you go to medicare.gov, you can review your plans. If you're working with a broker or somebody else that represents insurance companies, make sure that you go back to medicare.gov and look at reviews for that plan, and also consider the ratings that you see next to those plans. The next thing that I think would be important for someone to do is to, if you're considering a change and you're already working with certain providers, please ask them if they take that insurance. Don't be surprised when you go to the doctor and they don't take that insurance, because then you're going to have to find a different provider. As much as it would behoove us to think that we wouldn't have to do that midstream, it can happen, and it has happened. So you're going to have your insurance. It's just very important that you know that your providers and the plan that you are considering taking will accept your insurance. And if you need more information on that, I did a podcast already about what to do if you're losing your insurance in your area, or if your providers no longer take your insurance. So you can look up that podcast. Yes. And then this is another important thing, and it's happening now. Even if it didn't happen before October 15th, people are getting notified now that maybe a plan is no longer available in your area, or your providers are no longer accepting that particular time. Now is the time to consider what is available and to make these changes. Many times people make changes, but they don't realize how important these changes can be to them, especially as their health needs change. And so on my side of the desk, where I will have adult children calling about their parents and saying, but they need rehab options and they're not even going to qualify for that. Or they would like to go to this rehab, but their insurance is saying that they can only go to this rehab. Remember what I said is that your health care determines benefits. It does, and it has, and that's the way it is. So it's vitally important that you do your homework. And now is the time, October 15th through 12/7. Now, a word from one of our show sponsors.
At Family Partners Home, we help residents maintain dignity while promoting well-being. Residents receive 24/7 supervision and care in a home-like setting in assisted living homes that are located in residential neighborhoods. Each home is a single-family home designed and built specifically for those with dementia. For more information about Family Partners Home, 314-686-4468, online at familypartnershome.com. It feels like home. It is a home.
Let's continue learning about open enrollment. Now, I think it might be helpful to most people if we do a quick terminology refresher. Remember that traditional Medicare Part A is for acute care. It is for short-term rehab stays, home health visits, hospice, and the emergency room visits only if you are admitted to the hospital. Otherwise, they would be billed under Medicare Part B. Medicare Part B is outpatient, and it's urgent care, doctors, labs, diagnostics, therapy. Medicare Part D is vaccines, pharmacy, and drugs. Medicare Advantage, or MA plans, is a managed care plan offered by an insurance company like United Healthcare, Aetna, and Anthem. And within the managed care plans, there are some additional options. There is an HMO, which is a health maintenance organization, and a PPO, which is a preferred provider organization. If you want a lower monthly premium and aren't too particular about what doctors you see and don't mind getting a prescription to see a specialist, maybe an HMO is perfect for you. If you want more flexibility or don't mind a higher price tag, a PPO might be a good fit. But in 2026, please know that there will be fewer Medicare Advantage plans, but at least one plan in the area in which you live in. And I say that because in rural and outlying areas, there are less choices than when you live in a metropolitan area. And it has been sad to see that, yes, some people in more outlying areas lost the only plan that was available to them. So this is a guarantee that there will be fewer Medicare Advantage plans in 2026, but at least one plan in the area in which you live. Most people will have at least 10 options of Medicare Advantage plans. And bear in mind that Medicare Advantage plans usually include pharmacy and drugs as a benefit, while traditional Medicare requires a standalone Part D plan. Now, as I have looked at the new manual for Medicare in 2026, I can see that pharmacy, the out-of-pocket spending went from $2,000 a year to $2,100 a year. So it's an increase of $100 in your out-of-pocket spending, traditional Medicare or a Medicare Advantage plan in 2026. The Medicare prescription payment plan that was introduced in 2025 will continue for 2026. And if you opted into that Medicare prescription payment plan, which allowed you to pay a little bit every month, you will be automatically renewed unless you ask to opt out. And if you decide that you don't want to participate in that plan, I believe there has been a backlog of requests, and timeliness was not instituted for those, but they're saying that for 2026, opt-outs will be handled within 24 hours, according to medicare.gov. Insulin costs will be contained to $35 per month, and all vaccines in all plans will be free, which is good because there used to be copays on those items, but now they're included free. Now, this is a big change to traditional Medicare, but it's only going to happen in 5 states, so don't worry. And this is going to happen in 2026. In the past, those with traditional Medicare did not have to get a pre-authorization for a referral to a specialist. But if you live in Ohio, New Jersey, Oklahoma, Texas, Arizona, or Washington, for 2026, you will need pre-authorizations from a physician before seeking treatment for therapy and specialist. Now, a word from our sponsor.
Are you looking for resources on senior living? Check out guideforseniorliving.com for our free online senior resource guide to find senior housing, care, and community connections. Start searching now at guide number 4, seniorliving.com. That's guideforseniorliving.com to find the contact information for senior housing, care, and community connections.
Now let's return to the podcast. Friends, this isn't complicated and does not need to be stressful, but it does take time to get online to look at the medicare.gov website or to open the manual that was sent to your house. But it is also possible when you need help to reach out via the phone. And if you allocate 1 hour at the most, I feel confident that you can knock this out, and then rest assured you made good decisions and are in the driver's seat with your health care. It is okay for you to call 1-800-MEDICARE or to call your State Health Insurance Helpline. So 1-800-MEDICARE or call your State Health Insurance Helpline. But I do want you to be careful during open enrollment because all private insurance companies are phishing. And I don't mean with a phishing pole. They are PFISHING for new enrollees, and you may not be getting unbiased info. Your mail, you've probably already started receiving envelopes that look like they came from Medicare. But again, when you open them and really take a look at these envelopes, they are phishing for your business. And you should see in small print somewhere that it says it's Medicare Advantage, or that it will name the name of the insurance company that they represent. The same is true for when you do an online search. Don't be fooled. Even when I was doing my research and I asked a particular question that I wanted to know the answer to, and it was interesting that these private pay Advantage plans were leading the charge on the answers, but I knew that it was not a Medicare site, even though it made it look like a Medicare site. So be warned. And don't forget, 24 hours a day, 7 days a week, you can call 1-800-MEDICARE. But be aware that perhaps wait times on the phone could lengthen during a government shutdown like we are in currently during this open enrollment period. Be aware, of course, as I mentioned, that eligible older adults with limited incomes and assets, plus people with disabilities, may qualify for financial assistance with premiums, deductibles, co-insurance, and co-payments. And these subsidies will come from the Medicare Savings Programs. And if you want more information about that, it's MSPs, the Medicare Savings Programs. Now, things that we need to ask ourselves just in case we're thinking about not doing anything this enrollment time. Maybe you don't want to get online because it sounds confusing. Maybe you are very happy with the plans that you have. But if you think back, these are the questions that I want you to ask yourself about 2025. Did you have any hospital admissions in 2025? Any procedures? Did your health care change? Did your health status change in 2025? Have prescriptions been added or taken away in 2025? Did you move? Did you change your location? Also, did you get a notice that your plan is not going to be available in your area? Have you checked to make sure that these new prescriptions will still be covered by your plan? Did your doctor retire and leave the area? Or is he not in your new plan as a provider? And now you need to look for a doctor. And think about whether or not you feel limited by your HMO, your health maintenance organization, and if you would really like to have more options, because now is the time to do it. It's time to get on it and get it done. As always, friends, I love to leave you with a caregiver tip. And so for the caregivers who are caring for people who have Medicare insurance or are disabled, it's time to get prepared. Learn what the insurance covers and what it doesn't cover. Write down deductibles and out-of-pocket pharmacy limits. You can always check with the pharmacy that fills your prescriptions to see how close you actually are to meeting those deductibles. Are they signed up? Would it be helpful to be signed up for that Medicare prescription payment plan? And organize this information so that you have it when you need it for doctor's appointments, ER or urgent care visits, short-term rehab stays, and therapy visits. Take a copy of the cards, yours and theirs, or make a hard copy. You can take a picture on your phone of your insurance card, or you can make a hard copy for yourself to keep in your wallet. But please also post information on the refrigerator, because that is where EMTs and emergency providers are going to look first. Thank you, friends, for listening today, and I wish you success during Open Enrollment 2026. Thank you for joining me today. Please remember that this podcast is intended as education and not advice. Don't forget to share this podcast with family, friends, or colleagues who want to learn how to age in place, but also share this with those who find themselves in crisis mode. Please go to my website, seniorsupportstrategies.com, for more information. When you subscribe to Aging in Place Strategies and Answers, you gain access to premium content and professional tips on creating your own aging in place roadmap. As always, I value the time you spend with me.